So looking at this within the context of the individual symptoms, we have to understand, is there pain associated with that movement? Okay? And one of the most important things to consider here is that just because a movement is painful or sensitive, meaning, let's say, for example, when I flex my spine, I have pain in my lumbar spine. That doesn't mean that that motion is problematic or dysfunctional. It just means that they have pain during that, or it's sensitive to that motion, okay? Maybe they can't tolerate stress with that position or in that direction, okay? So there's a big difference between describing something as dysfunctional and painful, because we can't say it's dysfunctional, okay? Another example is a client after an ACL reconstruction. They're probably going to have pain if they bend their knee, right? Because their quadricep is fresh out of surgery, right? And they can't tolerate that. But does that mean that we never load the quadriceps or never bend the knee? No, we just have to structure the rehab process appropriately to gradually expose the knee to more stress. You see the difference there? So again, just because something is painful doesn't mean we avoid that activity and only work on something else, but there may be a case where we need to expose that muscle and joint to more stress and maybe change the variability around that local area, okay? So again, what movements are sensitive? What are they not able to tolerate? How much load can they handle before they experience symptoms? We'll talk today about a client that I had with patellofemoral pain. And when I do like a muscle test where I'm just checking their force production, I'm not looking for strength, but I'm looking at how much force can they tolerate. And I asked this client to kick into my hand and slowly build up the tension, 10%, 20%, 30%, 40%. And at around 50% of their maximal contraction, they had pain. But they didn't have pain at 30%. They didn't have pain at 40%. That just tells me that they're not able to tolerate that amount of force. So I need to potentially organize my rehab around giving back that muscular tissue the ability to tolerate more force. It doesn't mean that we stay away from knee extension. It just means that we need to change how we actually organize the rehab to build up that capacity. Does that make sense? Because we do have, in the health and fitness space, we do have the habit of avoiding things that are painful, right? So if someone has knee pain, for example, we stay away from the knee and we load the hip and the ankle. We go into glute work or foot and ankle work and we stay away from the knee, but many times the knee has to be loaded. And just because it's painful doesn't mean it doesn't have to be loaded. It just means that we need to have more structure behind the way that we load it. Okay?